Well, hello, Mrs. Johnson. How are you feeling today?
I am feeling better, thank you, Dr. Payne.
That's wonderful, Mrs. Johnson. And just think, you were worried that you might have side effects from the pills I gave you.
Oh, I took the pills for a week and got terribly sick. I had to stop taking them. After I read the disclaimer, I realized that people have died from taking those.
I see, Mrs. Johnson. So what exactly made you feel better?
I went to my brother's chiropractor. It turns out that I just had a minor back problem that was causing all the pain.
Oh no, Mrs. Johnson, please tell me you didn't go to one of those quacks.
Well, yes, I did. I've been coming to you for 3 months now and my pain hasn't gotten any better. As a matter of fact, it was getting worse.
Oh, Mrs. Johnson, don't you know that chiropractors hurt people? I see it every day in my practice.
Really? You actually see it every day?
Well, I haven't actually seen it every day.
But have actually seen it?
No, I have not actually seen it, but I heard that a chiropractor hurt someone when I was in medical school.
I asked my chiropractor how safe the treatment was and he said if chiropractic was dangerous that his malpractice insurance would be as much as yours.
What does malpractice insurance have to do with safety?
Would you agree that insurance premiums are claims-based? Meaning that the cost you pay for your malpractice insurance is based on the mistakes and mishaps of your payers.
Well, of course it is.
He pays less than $2,000 for a whole year. How much do you pay?
It's not important how much I pay. Can your chiropractor write prescriptions for drugs like I can?
No, he told me that he could treat my pain safely and I probably would not need any more dangerous or addictive, mood-altering drugs.
Look, Mrs. Johnson, I'm worried for your safety. Why don't we just do surgery on your back?
Why would I want to have surgery for a minor problem?
Because none of the pills I gave you worked.
But why would I want to have surgery when the chiropractic treatment is working so well?
Because, Mrs. Johnson, I am a medical doctor and that is my professional opinion. Those chiropractors are quacks, just take my word for it.
Okay, Dr. Payne, I guess you're right.
I'm glad to see that you've come to your senses. Now, when would you like to schedule your surgery?
Let me think. How about never, you moron? You really think that I would let you cut on me when there is a safer, more conservative treatment?
Well, it certainly didn't hurt to ask. Mrs. Johnson, I'm afraid I've done all I can to help you. You refuse my medical suggestions. You don't want to take the pills I gave you, you don't want surgery. I really think you would benefit from seeing a psychiatrist friend of mine. I think you have some issues that need professional help.
So let me get this straight. You give me dangerous pills that make me sick. Then you want me to have surgery for no reason. If I refuse, I must be crazy?
That is correct, Mrs. Johnson. Now, if you don't mind, I have another patient that I need to talk into getting surgery before I tee off at 1:30. I just hope she is more reasonable than you are. Good day, Mrs. Johnson.
Goodbye, Dr. Payne. Oh, just out of curiosity, how much is your malpractice every year?
It's a tad more than your chiropractor, but not much.
How much?
I don't see where that is any of your business, Mrs. Johnson.
How much, Dr. Payne?
I can only tell you that I have to work every year through April to pay it.
I was thinking a little over $60,000 a year.
A little. Now, good day, Mrs. Johnson.
Well, if your malpractic is over $60,000 a year and his is only $2,000 a year, then which you say is the safest?
Good day, Mrs. Johnson.
I'm sorry. Maybe I do need a psychiatrist then, because it would seem to me that if your malpractice is 30 times more than his, then he is 30 times safer than you?
Mrs. Johnson, I have neither the time nor the patience for this line of questioning. Chiropractors are quacks and they are not safe, and that's that.
Would you at least agree that since your malpractice insurance is 30 times more than his, that chiropractic is reasonably safe?
If that's what it takes to get you to leave me alone. Fine, chiropractors are reasonably safe. Now, good day, Mrs. Johnson.
So in your professional opinion, who is the bigger quack?
Neither is the bigger quack, Mrs. Johnson.
So if chiropractors are quacks, but neither is the bigger quack, doesn't that make you a quack too?
Good day, Mrs. Johnson. For real. Good day.
Good day, doctor. Enjoy your golf game.